in your opinion, what are the key elements to improve patient self-management skills?
And we're good at that, right? As MDT clinicians, I think that's one of the things that I really appreciated about MDT. And Robin was a strong proponent for prevention and self-management. So prevention ties into self-management, right? So we want to teach the patient to become self-diagnosticians. So they're not just passive recipients, because a lot of times we just tell patients what to do without clearly understanding why they're doing the things that they need to do. So I think being able to help that patient become their own diagnostician, understanding what the problem is and knowing when to do their self-treatment is very, very important. So I tell my patients during the time that they're coming to see me that they need to be able to detect early warning signs that they're about to have another episode of back problem or neck problem or whatever it is. So what's the earliest sign that you're about to have an issue? Stiffness, right? So most people ignore stiffness. So whenever you have just a stiff joint, you just say it's just stiff and people let it go. But then I say, nope, it's a baby that's about to turn into a bad teenager. You got to nip it in the bud, right? So you need to start doing your exercises. So I tell them, you do your exercises preventively. So before it starts to hurt, and when it's stiff, you do it, and you do it reactively. When you do have the pain, you do the exercise again. So I think knowing when to do the exercises is really important in self-management. And the other is having the patient understand that there has to be a balance in life, right? So if we keep doing flexion, what's the average amount of flexion we do in a day? About 4,000 times a day, right? Or 4.9 hours according to a recent study. So 4.9 hours of flexion in a given day, and we're only doing 24 minutes of extension, if that. So some people don't even do extensions, right? So they're constantly in mid-range flexion. So there's that imbalance. So I tell patients, you have to learn to balance life between flexion and extension, and vice versa. If you keep doing extension, you never flex, you're going to have a problem as well. So I tell patients to apologize to their back. What's funny, Mariana, is I work in a very small town in North Carolina. And once in a while, when I go to Walmart and I'm in a rush, I try not to make eye contact because I probably treated about 75% of the population in that area. So once in a while, I'd get patients from years ago that I've treated, and they remembered me, and they'd say, you know, Cora, I saw you. I don't know if you remembered me, but a few years ago, I came to see you for my back. And the other day I was mowing my lawn and I started having back pain, and I remembered you. I could hear you in my head saying you got to apologize to your back. And so I did my exercises and I felt good. And he was thankful. And it made me feel good knowing that I made an impact. You know, I think that's where your job becomes more satisfying, when you know you've helped somebody, not just for that period of time that they're coming in to see you, but even for the years to come. You know, so I think, again, teaching patients to balance life and learning to apologize for that frequency of flexion is important.
I think that's one of the beauties of MDT, is the self-management, the ability that we give the patient, the way that we empower the patient so they don't go back and depend on the treatment passively like usually is. So I think that sets MDT apart, and I think that's beautiful. Like, as you said, you just saw a patient that years ago remember what you said and was able to deal and cope with his pain and problem and prevent crisis of happening. So I think that if we can do that, the impact we have in our patients' lives is just amazing.
And the cost of healthcare. It's pretty expensive to treat musculoskeletal disorders. It's I think right now it's actually the most expensive one. I got to check, but it used to be heart problems, but now musculoskeletal disorders, the cost of treating those have become an immense burden in our society.
Top 3 for sure.
Yeah.